So now we're going to show the gait investigation for our subject that we just recorded, and we're actually going to show it as a brief movie here in the recording, showing all the different foot pressures that collected in the foot during the investigation. So here we see the movie playing, and we see the red colors are high pressure, which typically accumulates in the forefoot, near the ball of the foot, near the toes, and also in the heel. So this is a very common type of gait pattern that we see very often. Patients exhibit the pain in the heel and also in the ball of the foot. The purpose of this is to help us to understand the way someone walks, the pressures that develop in the foot, and how we can develop a customized orthotic to take into account all the problems that someone encounters in the foot, as well as all the issues that need to be addressed for a custom-made pair of shoes. So now we're going to take an average of the pressures in the foot and check the center of force. The center of force is very important in showing us, does this individual walk straight out to the outside or to the inside of the foot? And here we're going to analyze even further. We see the heavy pressures by the big toe on the left and in the heel, but on the right side there's less pressure, and we know these are average pressures. And now we're going to check our peak pressures. So we calculate this very carefully through the algorithms we have here in our computerized scientific gait investigation. And here we see the center of force is somewhat uniform on the right, but when you look on the left, it's somewhat non-uniform, and there's pressure at the ball of the foot on both sides, as well as in the ball of the foot. Also, we notice there's pressure in the heel on the left, and this is somewhat of a normal type of gait pattern because there's always pressure by the big toe. We need that to step off and move forwards on every step. The ball of the foot tends to take great pressure in most cases. We would add special types of features to the custom-made orthotics and the custom-made shoes to take the pressure off the ball of the foot and to take into account the pressures in the heel. This is a very helpful device for us in creating the ultimate shoe. If someone had a center of force to the outside or the inside, we can take that into account, address it with a custom-made orthotic and a specialized shoe as well. So the key here is that we want to make comfort for everyone in the orthotics, in the shoes. And with Dr. D-LuCS, the luxury is in the comfort and the style. Alright, so now we're about to continue on with our fitting and measuring. This is a very important part. This is the tracing of the foot for the custom-made shoes. So now we're going to check range of motion of the foot and ankle, part of our full biomechanical examination of the lower extremity. Start on the left foot, checking the mid-tarsal joint, ankle joint, So now we're performing our fluoroscopic radiographic examination of both feet, so we better understand the bone structure that we're dealing with. Here we check into the great toe joint. We check range of motion, and it's normal here. We check across the ball of the foot. and we check into the midfoot, across the bones of the foot, scanning across, and back into the ankle joint. And here we can take a picture and save it. We'll go back into the ankle joint here. And go to the next foot. Big toe joint. Scan across the ball of the foot. Midfoot. And again into the ankle joint. Okay, so now we're going to perform our ultrasonic examinations, diagnostic of both feet, and we typically look at the plantar fascial ligament, which is the bridge between the heel and the toes. It takes a lot of impact, and many individuals have concerns with this part of the foot. Okay, so here we have the plantar fascial ligament image, and it appears to be a normal image for us here on the screen. So here we're going to cast our subject for the custom-made orthotics, which is done in a very unique way. First, we must check the heels. The heel is very important, as it is the first part of the foot that usually strikes the ground. It must be taken into account. So now we apply casts for the orthotic in a very special way. Range of motion, biomechanical. And then we cast the patient for the orthotics, or the subject here, in the neutral position, which is where we have her positioned right now. Right. And now our patients experience a nice relaxing whirlpool. Massage, very therapeutic, with carousel, which is moisturizing and exfoliating. And this is very beneficial to rejuvenating the feet.
Of course.
Right. So at this point, our customers get to design their shoes, the custom-made shoe. And the beauty of it all is that they get to design it to be whatever they want it to be. With the help of our design sheet right here, with all different types of footwear that are available, as well as all the colors that we have to work with our customers here.